This is Angelique. So in today's video, I will be talking about the kidney symptoms as well as more in depth how it started with the whole situation with the kidney and about being put on dialysis. So let's get right into it. So how this whole thing all started was I I went to see specialists and I got regular checked out every whatsoever. So in every year I would get checked. So they would do certain tests on me and blood works. I would talk to specialists as well as every it was for every year I would see a specialist, but like MRI, I would see for every 3 years. So I have a medical condition. It's called tuberous sclerosis complex. So what it is, it's translated, it means potato tumor, which the tumors is not cancer related. The tumors, they can grow into organs. So for example, inside the brain, the heart, the lungs, and the liver. So these tumors are non-cancerous. So I get checked every whatsoever to see if I have it. So by far they said they haven't seen any tumors or anything. So for now everything is good. So they're not too worried, but just for precautions to be on the safe side, they still want to check. So around the time I was 18, I um, I seen one doctor, and she told me, "Hey, we just got your blood work, and we can see that your kidney function is at 55%." So I didn't think much of it. I went to the office with my mom. My mom was asking, "Hey, why is it 55? We get checked on a regular basis to see how my health is and everything else." And what's going on. And they said, yeah, but something like a kidney failure can happen fast. It can take a few years, or it can take less than a few years. It can even take like 8 months or so, depending. Everybody is different. So some people are more likely to get more damage than others. So then we were talking at home about it, like, hey, what's going on? Like, this is weird. Shouldn't they have told us even before? And even my dad says probably the other doctors knew something was going on, but they didn't think it was necessary for me to know right away because it wasn't so serious. So he was getting mad, saying, hey, this is stupid. They should have said something beforehand, the other doctors. But what can you do? I got lucky enough, they told me beforehand at 55%. So, and then I, time flies, time goes by. Then I get a phone call from the hospital, and they tell me that was in Watson Lake. And then they tell me, hey, you haven't come to the appointment for a while now for blood work. And then when are you coming? Like I said, well, you guys need to let me know. I don't know when I need to go. Because normally they call me, and then they called me and said, hey, you need to come. We haven't seen you in like 3 years, because it was 3 years when I didn't get checked. So, and yeah, I went, and then they told me that my blood is oily. And I said, oily? And they said, yeah, your blood is oily. So I said, how is it possible that blood is oily? So they said they don't know. They need to do more blood work and, urine test to check what's really going on to get deeper into it. So, and then they took the time to, then time again, they call me once they find the results. So from all the results I've been doing, they came back and they said, "Oh, you know what? We need to check on you. You need to come back to the hospital. It's urgent." So they called me very early, and then when I woke up, that time I wasn't staying with my parents. I lived at a friend's. So then I went to the hospital, I went to emergency, I seen a doctor, and the doctor told me, you need injections. I said, for what? And he said, you're not producing enough blood in your body. And I said, oh, how? Oh, we need to give you injections. So I said, okay then. So they gave me an injection. They got things ready for me to get medevaced. So before that, my mom came, and then my mom was with me inside the ambulance. We drove to the airport. So then they flew me to Vancouver. So got medevac by an helicopter. And yeah, so when I was in Vancouver, inside the helicopter, I landed. Another ambulance picked me up, and then once they picked me up, they drove me to St. Paul's. So St. Paul's, they asked me, "Which hospital are you in?" I said St. Paul's. So they have to check if I know where I'm going, which I know. But even before all of that started, I did notice as well kidney symptoms. Like I didn't know they were kidney related. I was just wondering, like, yeah, why am I feeling like this? Like, the leg cramping, my foot, I would have constantly cramps. I would feel tired. I would feel weak. I would eat less. So I was losing weight. So I was wondering, what is going on with me? And then when we went to the doctor and I told them everything, it made more sense. But so yeah, I I winded up in St. Paul's. I seen the doctors. So as I'm there waiting to get my answers, I talked to the one of the male nurses, and he says to me, "Have you heard of dialysis?" I said, "No, I never heard of it in my life." So he showed me a video and said, "This is what dialysis is." So he was playing that video and then explaining it that I will need to do it. So he asked me, "Do you want to do it?" At first I was like, "I don't want to do it," but you know, at one point I said, "Yes, I will do it so I can live." So yeah, then they did the procedure on me. I was in one of the hospital rooms where the patients stay. So I was lying in on the bed, and then they gave me uh, these syringes, with the numbing to numb the area on my belly, to so I don't feel the scalpel, this surgical knife. So before that, I asked them, "You guys are not gonna give me anesthesia?" They said, "No, this is too much of an expensive product, and the surgery is too small. So we just need to give you the injection." So I thought, well, okay, then as long as I don't feel any pain, it's okay with me. So they put the injection in there. It was some kind of pink liquid that went into my body. So they started cutting. I still felt it, so they added more. They gave me like 7 to 8 injections in there. So to insert it inside me, that liquid, so my lower stomach is numb. So I was screaming like you wouldn't believe it. Even the nurse, when she left, she came upstairs. She said she could hear me screaming from the main floor, and I was on the sixth floor. Well, of course, this hurts. What else am I gonna do? Laugh? Like, it was so much pain I never felt in my life. Even when I had my son, that wasn't even painful enough. Just to get cut open and to feel all of it, that was so much painful. So yeah, they cut me open. Then um, they put the tube inside of me, and then they did another cut, so the tube sticks out, so the catheter is just sticking out of my stomach. So that dialysis is called peritoneal. So I would be hooked up onto a bag, and that dialysis I did 8 in the morning, lunchtime, and then at 4 and then at 8 again, so 4 times a day. So the nighttime one was a higher dose, so I did 4 times a day, every day. So that was my routine. So when I was staying in the hospital, I was doing my dialysis and what else? I stayed in the hospital for just about a month. Then they said to me, okay. Then they asked me, do you want to be on social assistance? So I wasn't sure what is social assistance. And my mom said to me, yes, you should go because they're going to help you. And then I said, yeah, okay, I want to be on social assistance. So my social worker, she drove me to the airport, and then we went together to the airport. So I did everything. I walked to the terminal where I need to go to get, when they examine you with the tools to see if you have something on you, you know what happens in the airport. Because that was my first time too. I never flown alone, so I was anxious. So she says, "So just go straight and follow everybody. You're gonna be fine." So after that, I was on the airplane. Then we flew from Whitehorse to Whitehorse, and then I was in Watson Lake. So my mom picked me up. So I was staying in at the friends. Then after I was staying at the friends, at my friends, they gave me all the information I should order, the dialysis supplies. So they gave me these caps. You you screw them into uh, the catheter with the dialysis, and inside they have iodine in it, so it stays clean. And then the bags I got for the morning and for night. So they sent me 15 of those, 15 boxes. So I was just doing the dialysis as I should. And yeah, so I was going with that. I kept even calling. Sometimes they would delay with the packages, and then there's miscommunication, which is nothing new. And when I was staying with my friend, I was having I had an infection too. I was puking blood. That happened, and trouble sleeping too, because my body was changing. I wasn't eating much too, because I also had an infection during that time. When I was staying with her, I moved to somebody else. I stayed with, and I was doing my dialysis there, and I had that infection, like I said, when I was vomiting blood, and I was doing the dialysis. I even the bags that I filled up for the peritoneal, it got too big. They just about exploded. So I wasn't paying attention because once it's full, you're done. But I kind of forgot to close it. So at times I was leaking out of my catheter too. So and then I would need to every 6 months or so I would need to get the catheter changed, and I had an infection because I said, okay, I don't have enough bags to the stuff, to strain out, and I told that one nurse in the hospital in Watson Lake, and she says, oh, you know what? Just take an old bag, take a cloth, clean it, sanitize it, and then place your catheter into it and strain it out. So I did. And then I got another infection. So I went to the doctor. When I had that catheter changed every 6 months as I should, they didn't know how to read instructions. And they said, oh, how does it work? So he goes on Google. I told him, why are you going on Google if I have it inside the manual right there? You can just read it. It's right there in that orange envelope. Oh my God, they make everything so difficult. But yeah, so I got antibiotics for it. Then I was in Whitehorse Hospital as well. That's where they changed it. So every 6 months I had to go and get it changed. So they gave me that emergency set. So yeah, and then what else? Let's see. yeah, with the infection, I had two infections during that time. Then after that, I was staying in the women's shelter. And when I was in the women's shelter, still another infection. It's like, oh my God, I cannot escape these infections. So, nevertheless, when I was in the women's shelter, I started to feel chest tightening at one point, and then I wasn't eating much. I had insomnia. I wasn't sleeping. I would maybe sleep, I don't know, maybe like an hour or 30 minutes, and then I wouldn't sleep. So, with the depression too, I used to wake up. I would go to bed at 8, take my medication, and then wake up at 2 or 4 a.m. in the morning. The rest during the day, during that time, I would draw. I would go even to the library, have some pictures printed to color in. So that's what I was doing during the time when I was staying in the women's shelter. And then within a little bit after, yeah, like I mentioned before, the insomnia. I had insomnia. I was I was waking up very early. I only had like an hour, 2 hours to 30 minutes maybe, but not less than that of sleep. So and then I didn't eat for a whole week. I got thinner and thinner. I started to feel chest tightening. I puked blood again. So in total, I puked 3 times blood within the whole time I was doing dialysis. So I wasn't feeling well, chest tightening. I felt like like an elephant or something is heavy on top of me sitting, and it was hard to breathe. So I walked to the hospital, which is only like 9 to 11 minutes walk. So I came there and I told them what I'm feeling and about the vomiting blood. So they went and checked on me. They did my blood pressure, and no, actually, that was, yeah. I went in between to the hospital and leaving the hospital and going back to the women's shelter. So I was sick, then I was doing good. So I went back and forth. My bad. I forgot to add that. So then I I started to feel the chest tightening and hard to breathe. Then I walked within 9 minutes, 9 to 11 minutes, I was at the hospital. So I stayed there longer. So when I stayed there, they did the blood pressure. My blood pressure was 218. Then I vomited, but it was green. It was very bright. What do you call it? Like a fluorescent color. Like it was very bright green. And what else? The first night when I was sleeping, I started to actually get restful sleep because the insomnia I had for 4 months. And when I was in the hospital, they gave me the medication. I started to sleep better. And then I was sleepwalking. I woke up at the end of the hallway, and I'm like, "What's going on? Like, why am I standing there?" I thought I was in bed sleeping. So again, I was sleepwalking. So it happened twice. And then when I was puking, it was so intense. I actually popped a vein in my eye. So yeah, I was when I was in the hospital. When I arrived too, they called my mom and said, "Hey, you need to come. It's 11. It was around 11 when I came. So my oxygen level was at 40. I started to look very pale, almost blue. My mom was crying. I started to black out, and they gave me the oxygen. I started to feel better. Then they medevaced me to Vancouver. I got picked up um, again from the helicopter. They bring me to St. Paul's. So I was staying in St. Paul's. I arrived at around 5, but as I entered the hallway, I I looked up at the ceiling and I could see the bright lights, and then I started to lose conscious. So as I was already in the elevator, my body left, and then when I left my body, I could see these bright colors like a kaleidoscope. You know, they start to change like frequencies. So it was very colorful, and I could see them move like this. And then and then I was out of it because they were telling me I died. I think I died too. I mean, my blood pressure was very high, and I lost conscious, and I already was up. I left my body. So yeah, they were telling me I died. I said yeah, and so I was upstairs in the ICU. They uh, they checked on me. How am I doing? My mom called me, and I told her like, hey, why were you not there? Like, you know, I'm here in ICU and I'm not feeling well. And she's like, yeah, I know, but I had to work. It's like, seriously, that's what you're saying. You should be there with me. So she says, I'm sorry, but I couldn't. And I said, well, I'm sorry too. And I hung up. So I was resting there for 5 days. Then they moved me to a different room, so that's where I was staying. Then they moved me to another room. So this is this is it for this part of the video. Tomorrow I'm gonna make another video continuing with the talking about the kidney and dialysis. But in tomorrow's video, what I'm gonna continue talking about, I want to talk about diet and kidneys. So I'm gonna go more further into this. That's for tomorrow. So thank you for watching.